Hello, I'm Dr. Shishir Seth, hematologist and bone marrow transplant specialist at Indraprastha Apollo Hospital, New Delhi. I would like to talk about multiple myeloma. Multiple myeloma is one type of blood cancers which arises from the cell called plasma cells. These cells, they reside in the bone marrow inside our bones. These cells, they are responsible to provide immunity to our body to fight infections by producing various protein that is called immunoglobulin. When cancer develop in such cells, they are not able to produce proper immunoglobulins so that body is not able to take care of infections properly. When these cells, they start growing inside the bone marrow, they suppress the formation of normal blood and they cause damage to bone. So bone become damaged and bone melt down and releasing calcium in the body. Multiple myeloma is a disease of relatively advanced age group, but in Indian subcontinent, we are getting such disease even in relatively younger people of 30s, 40s, but it is generally the disease of age group beyond 60. In this disease, patients generally present with unexplained severe pain, usually back pain. Sometimes they present with the unexplained fracture of bones, low hemoglobin, kidney dysfunction, sometimes some other vague symptom like weakness, fever, can be a presenting feature. Many times these cancer, they presented with vague symptoms, so they are diagnosed relatively late. Diagnosis of these diseases, they are made by high clinical suspicion. Usually when we are suspecting that person may suffer from multiple myeloma, we are doing some blood-based and urine-based tests to confirm that probability of myeloma. Usually in blood test, we are doing various tests like complete blood count, kidney function test, liver function test, some specific tests for myeloma like serum protein electrophoresis, free light chain assay, serum immunoglobulin assay, various radiological tests to look the bone, and the confirmation of diagnosis that is made by bone marrow examination. Generally, in blood test, patient may have low hemoglobin, high calcium, very high ESR, increased protein with generally in blood test we are finding low hemoglobin, increase in protein, especially increase in globulin and decrease in albumin, very high ESR, increase in calcium, increase in creatinine. These findings may be seen in various combination. Subsequently, the specific test for myeloma in serum protein electrophoresis, they may show increase in monoclonal protein band, that is called M band. In free light chain assay, either kappa or lambda, they are very high with decrease in other component. In immunoglobulin analysis, one of the immunoglobulin is very high and reduction of other immunoglobulins is seen. When based on symptoms and these investigations, our suspicion of myeloma is very high, we are doing bone marrow examination, which is showing increase in plasma cells. Other analysis like FISH test or cytogenetics, that to determine the biological nature of these plasma cells, which can indicate the aggressiveness of disease. Various imaging studies like CT scan, MRI or PET scan that may explain the amount of bone destruction, any nerve compression, which is commonly seen with multiple myeloma. After confirmation of the diagnosis of multiple myeloma, we need to plan the treatment for the patient. Multiple myeloma is a highly sensitive disease which can respond very good to the present treatment options. These treatment options, they may vary according to the patient age, general conditions and comorbidities. Usually these treatment can give 8 to 10 years of meaningful quality life year to the patient. For a very fit person, usually aim of treatment is initially giving various medicine to control myeloma. After controlling the myeloma, we are planning for autologous bone marrow transplant, and then we are putting these patients on maintenance therapy. The options of initial treatment decided on the various patient condition. Most of time we are selecting 3 drug regime to control myeloma. Most often these drugs, they are bortezomib, lenalidomide and dexamethasone along with zoledronic acid to make bone strong is selected. These treatments, they are given in various frequency over 3 to 4 months of time, which melt down the myeloma cells and bring the disease in control, which can be monitored by various blood and urine based tests. After controlling the myeloma, we are planning for autologous bone marrow transplant for a fit patient to keep the disease control for longest possible period. In bone marrow transplant, patient's own cells, they are collected, and after giving high dose chemotherapy, these cells, they are reinfused to the patient body. High dose chemotherapy destroy visible and invisible cancerous cells, which also damage little bit to the other organ, most commonly gastrointestinal tract, which presented with mucositis. With the effect of high dose chemotherapy, existing blood forming system that get destroyed, and stem cells provide a new blood system which develop over the time over 10 to 15 days. During this time, patient is admitted in bone marrow transplant unit in a very specialized room which have a HEPA filtration to prevent any type of infection. For this procedure, patients are there for about 2 to 3 weeks. After relapse from initial disease, patient require another type of treatment to control the disease, and there are various drugs available for this situation, and they are able to control the disease and giving more meaningful life to the patient. Generally, after 4 or 5 lines of therapy, myeloma becoming more and more resistant, and the response to treatment is not as good as before, and eventually the disease may become resistant to the most of the available treatment. Some of the myeloma patients, they present with renal failure, their kidney tests, they are abnormal, and many times they are on dialysis. When the multiple myeloma is suspected in such category of patient, I will say that is the relatively good news for these patients, as this disease is amenable to treatment and we can treat such patients and can reverse the kidney damage, and they may become even dialysis free. And by available treatment options, they can have a many year of meaningful quality life. Apart from main medical treatment, there are some other supplementary treatment that is required in few subgroup of patients, like various surgical options in case of fracture of bone or nerve compression. Sometime for the pain relief, which is not happening just with the medicine, radiation therapy that is offered. One of the bigger challenges in all these treatment is the risk of infection. Because of disease, body is already immunocompromised, and with the treatment also the body immunity that goes down, and these patients are more prone for infections. Most of the infections they arises from our body itself. Our body that is full of bacteria. Our intestine they have a trillions of bacteria. Our skin, our mouth they have a lot of bacteria. So to control the infection, we need to flush out the intestinal bacteria by having daily soft motion, avoiding constipation, taking daily shower to flush skin bacteria, to do the mouthwash so that oral bacterial contamination can be minimized, by doing lung exercises like spirometry that reduce the risk of pneumonia. Sometimes few patients they can also given supplementary immunization, and in some patients uh, IVIG medicine can be given. External source of infections is very few, but they are avoidable. So we advise such patients to take only freshly cooked food. Raw fruits and vegetables should be avoided. Only thick skinned fruits which can be peeled off easily like banana, oranges, pomegranate that can be taken. If someone is very fond of fruits and they like to take fruits, so they should put fruits in boiled water and can take the fruits. For change in taste means small candies, chocolate chips, wafers and namkeen which is packed in uh, small packets can be consumed, and once packet is open they should take that, and remaining of the uh, material that can be taken by other family member. They should avoid to going in crowded places, dusty environment, not to meet too many people, especially the people who have a fever, cough, cold, skin infection. All these measures they can reduce the risk of infection and give better outcome of our treatment. After this, patient get discharged from the hospital, and slowly over few week of time they can recover back and goes back to their normal life. After completing this procedure, we are putting patient on maintenance therapy. In the older and frail patients, we have to select the gentle and milder approach, and with the treatment these patients they have many years of meaningful quality life. Unfortunately, in the present medicine, myeloma is bound to relapse. This relapse may happen after many years, and sometime with few aggressive diseases that may happen very soon after the treatment. Unfortunately, there are still few patients, they do not respond well to the conventional present available treatment options. Medical science that is evolving over the time. About 2 decades back, myeloma was considered a disease where the survival was possible for just for few years. Now, with the advancement of various medicine, the survival can be sometime more than decade also. New and new medicine, new and new research that is coming, and that is adding more tool in our armamentarium. Various monoclonal antibodies, bispecific antibodies, and even the new development in the field that is a CAR T cell therapy, that are the options of myeloma patients who are relapsing after initial therapy. So there is a big hope for myeloma patient. With the available treatment, we can add many years of meaningful life to these patients. Even patients who presented with the severe dialysis dependent renal failure, many of such patients, they become dialysis free after receiving myeloma treatment. There is a big hope for myeloma patients, and we can assist them to provide a meaningful life to them. Thank you.